So settle in. You're safe here. So let me just check some details. Can you tell me what your pet's name is? Perfect. And are they male or female? Okay. And what's their date of birth if you know it? Lovely. So can you tell me what brings you into the vet clinic today? Okay, yeah. Perfect. Well, that makes perfect sense. So I'll just grab my gloves and we can get started. So today we'll just be doing a general checkup, yes. Perfect. Just to make sure everything's looking good and there's nothing to be concerned about with your dog then. Okay. Right. So I'll just explain everything as we go. This is just a calm, gentle checkup. Absolutely nothing to worry about. No needles involved. Nothing scary at all. Just to make sure your dog is all well and everything's looking good. Okay. Right, let me just take a quick look at my notes. You just get comfortable. Just right. Okay. So I'm going to start by just checking your pup's eyes, if that's okay. So, right. Okay. Lovely, healthy eyes. What a gorgeous pup you are. So is your dog toilet trained yet, or still using puppy pads? Okay. So a lot less accidents than when you first got him. Okay, well that's good to know. Right. Let me just have a quick look, just feel the pup's neck there. Okay, yes. And yeah, just turn him around. Okay, yeah. I see. Lovely, lovely. And if you just turn him to face me again, I'm just gonna have a quick look in his nose, make sure it's not dry or anything. Lovely, lovely, lovely. And I'm going to attempt to open his little mouth and check his teeth. Okay. Right. Okay, we may need to see if we can brush his teeth just maybe once or a couple times a week, maybe. Because he appears to have some build-up, okay? But nothing we can't fix. Just check his eyes again. What a lovely pup. So have you had him long? Lovely, lovely. Alright, just going to check his back. Okay, just checking his back. And I'll just feel his sides. Now, if you want to, just turn him to face me. Excellent. I'm just going to look at his little paws there. Right, okay. Okay, you may need a toenail clip very soon, but we can book you in for that at the front desk, or you can do it at home. Just depends. Right, well, good news is his eyes, his nose, and mouth all look clear, apart from a bit of build-up on his teeth. Paws are as they should be. Nails may need a quick trim very soon, but as I said, that can be done at home, or we can book you in. Okay, so you're doing perfect. I'll get you a little treat. There you go. Good dog, good dog. So, is he up to date on all his vaccines and wormer and flea treatment? Oh, you're not sure? Okay, let me just check my computer over here then. Right. It looks like he's due for flea and wormer very soon. So our receptionists can sort that out for you, and they can make it up, and you can take it home and get all that up to date. Right, so I'm going to just check your dog's heart. Right, so I'll just pop these. Now, this will be a bit cold on your dog, so you may be a bit uncomfortable, but just right. Nice strong heartbeat, that's what we like to see. Okay. Yeah. Excellent. And I'll just check the other side there. Perfectly healthy heart there. Just as it should be for a dog his age and size. It varies from breed and age and, weight and stuff, but from what I can see, perfect. Now, has your dog been weighed recently? No, okay, not so. Right, okay. Well, I'm going to give him a little treat there again. Pop him on my scales just here. Right, okay. Now, it looks like he's gained a couple kilograms, so that's good. I'll give him back to you there. Right. So far, everything looks as it should be. But I'm going to do a more thorough check of the skin and the fur, and just in case there's any fleas or anything, or ticks. That's not what we want at all. So, just in case there is anything, I'm going to put my mask on. Because you can never So, just going to check in his ears there. Trying to get my torch out again. Just checking in his ears. Okay. Right. Okay. There's a bit of build up in his ear. In the left one there, which I believe is due to his ears not getting air because they, are quite droopy. But that's no problem. We can prescribe some wipes, ear drops, and we'll teach you how to clean them out, which needs done maybe twice a week or so, just depends. Yeah, it can get quite smelly and uncomfortable and irritate your dog if it's not cared for properly. And I'll just check the other side too. Okay, right, I see. Okay, and the other ear is quite the same, so I'm just going to quickly write you up a prescription for some little wipes and drops and some powder that can be used. And this will soothe his ears. I'm thinking he may need to go on a special food too, just due to him seeing some red bumps in his ears too, which could be a sign of an allergy. But I'll keep looking at his skin and see, and his fur, and see if I spot anything else. Right, if you just face him towards me, perfect. With one last look in his little eyes there. And yeah, perfect. Okay, yes, very clear eyes. And he's got good hearing, because when I rattle my treats over here, he perks right up. Now I'm just going to look in his nose again. Right, okay. And his mouth. Excellent. Right. So brushing dogs' teeth is quite the task now. They will run away, they all bark. But I've got these little toothbrushes that go on your finger, and it should make it easier. And I've got some doggy toothpaste here too. Just if you want to trial that at home. But if you struggle, we can do that when we clip his nails too. Yeah. Right. So I'm going to give his fur a quick brush, just to make sure we're not missing anything. Alright. Okay. Just giving him a good brush, just make sure I'm not missing any fleas or anything. So far, I think we're okay. Yes. Okay. Well, so I've got your prescription here. Everything looks good as far as I can see. We do have some time. If you would like, I can cut your dog's nails now. If not, if you're in a rush, then we can do it another day. It's entirely up to you. Okay, another day. That is absolutely fine. Right, well, I'll give you this prescription. ask about flea and wormer treatment at the front desk too, as I believe he is due. Okay. Right, so give this. Right, that's for you, just to give to the front desk, okay? They will get you sorted with your new wipes and stuff for his ears, and they'll give you that little toothbrush I was on about. Just a trial. But again, like I said, if you struggle and find the nail clipping and the teeth brushing is not something that you're able to do successfully, then give us a shout and we can book you in to do that on a regular basis for you. Okay. Okay, good. Well, I believe that's everything tonight. Everything looks healthy, as it should be for a puppy of your age, and yeah, I believe the only things was the nails and the teeth brushing and ears, but again, I've got the prescriptions, I've given them to you, and that should be able to get sorted. And I'm also going to give you this little leaflet to book in with us again in 3 months. Just have a look. Right, you can discuss dates at the front desk, but that's just to say I'd like to book you in again in the next 3 months. Okay, well, in that case, I believe that's everything. It's been a pleasure seeing you and your dog tonight, and I hope you enjoyed the rest of your day. It's been lovely seeing you at